Hello friends, I am Dr. Ankit Bansal, Senior Pulmonologist and Critical Care Specialist, Fortis Hospital, Jaipur. Dear friends, as we are aware that respiratory disease are on rise, and also we have recently encountered the pandemic which was COVID pandemic. We have seen there are certain chronic lung diseases which included lung fibrosis, COPD. They are on the rise in the global scenario. In that regard, possibly we have to think in the prospect of maybe lung transplant. And to discuss, we have with us Dr. Govini Balasubramani. He is the head lung and heart transplant at Fortis Vadapalani, Chennai. Along with him, we have Dr. Sindhura Koganti. She is a transplant pulmonologist at Fortis Vadapalani, Chennai. So to start with the discussion, I would like to ask Dr. Govini, what we understand by lung transplant?
Yeah, lung transplant is basically removing the diseased lung from the recipient and then implanting the new lung to the recipient. So normally we'll take this diseased lung from the brain dead donors and then we'll implant. So this is how the lung transplant will happen. Lung transplantation normally will take lungs from the donors, that is the diseased donors, and will implant into the recipient. A recipient who is having a diseased lung which can be removed and then implant the new donor lungs to the recipient.
So ma'am, my next question to you is that what are the patient who are the probable candidates for lung transplant?
Any patient with chronic lung disease like COPD, lung fibrosis, ILD, COPD patients who are on oxygen requirement, who have severe breathlessness, who are not able to walk within the house and not able to perform the regular activity, they are the candidates which needs to be evaluated whether they are a good candidate for transplant or whether they can be continued on medical management if there is any good improvement on medical management.
So Dr. Govini, once the patient are assigned that they are potential candidates for lung transplant, how they enroll in your transplant program?
So these patients first we evaluate. Once evaluate is completed, we'll have a committee comprising of all the special doctors like a gastroenterologist, dentist, gastro, and then a pulmonologist and psychologist, dietitians, and then cardiothoracic surgeons and anesthetist. So we evaluate with the committee, and if they say go ahead, and then we'll list them in our central committee. Central committee in the sense it is being run by the government. So whoever is eligible candidate needs to be listed. It has to be listed only through the government organization. So once it is done, then they have to wait for the organ allocation. So organ allocation normally it's like a first come first serve kind of things. So if they register early, they will get the early organs. If they register late, then you have to see how many patients before them registered, and then accordingly they will get the allocation.
Still sir, what is the normal waiting period?
The normal waiting period will be anywhere between 4 weeks to 3 months depending upon the blood group. Normally if the patient recipient is O group, the chance of getting will be little delayed, whereas A and B they will have getting the organ will be little bit earlier, whereas AB, because they are the universally accepted universally recipients, so they will have a better chance of getting the organs.
After lung transplant, how many days the patient needs to stay in the hospital?
So normally these patients they need to be in the ICU for at least week to 10 days time. Once everything is fine, and then physiotherapy will be giving, and then all the medications required medication will be given. If they are able to walk and they can able to eat, and then they can do a good exercise, then we'll shift them to the room. That will be in an isolated room, allowing only a limited persons there, like only one can be stay with the patients, wearing a mask and gown for at least for another 1 or 2 weeks. And once he is okay, then normally we'll discharge them after 2 weeks. So the total period anywhere between 3 weeks to 4 weeks they have to be in the hospital after the lung transplantation.
So my another question to Dr. Govini is, do we anticipate any major post-operative complication in these patients?
So normally these patients in an early period, they might have early rejections, and after the second week onwards they'll have a high chance of infection because they will be covered with the immunosuppressive drug. So we have to titrate the immunosuppressive drugs so that the infection will not set into the patients. That is how we can able to do them. But again there will be some minimal complications regarding some air leak will be there, some bleeding or some kind of voice issues. That are all very minimal things. The major issues will be only on the rejection part as well as the infection part. So normally the rejection will be around 3 to 5% of the patient will be anticipated in the first 3 to 4 weeks, and whereas the infection will be set in after that.
After the transplant, ma'am, the precautions are very important. So what are the precautions a patient should take after the lung transplant surgery?
So after transplant surgery, patient will be on immunosuppressive drugs which will reduce your immunity so that the body accepts the new organ or the new lung into your body. So when the patient is on immunosuppressive drugs, there are high chances of getting infection because lungs are directly exposed to the outside air and all. Whatever you inhale, all the fungus, bacteria and all can directly go into the lungs. So that is the reason why post-transplant patient should be very careful, wear a mask and try to avoid the public places to minimum of 6 months after the transplant.
So to conclude, as we know, a patient with chronic respiratory disease and chronic respiratory failure on oxygen support, confined to bed, fearing 1 or 2 complications, fearing anticipating admissions for any exacerbations, I would ask you, sir, one by one, where you place lung transplant as a ray of hope to these patients with chronic respiratory failure.
Yes. So normally the lung transplant is indicated those who are in a end stage lung diseases. So their life period anywhere between 6 months to 2 years. So to prolong this, their lifetime, second thing is the quality of life. So we have to do the lung transplantation. So with this, they can live up to 10 to 15 years, and they have to take care. Even if you are, once we do the transplantation, that doesn't mean that you can do all the activities in open air activities. So you have to take a lot of precautions. And these patients, they doesn't need to have a oxygen support in a post transplantation period. Normally we'll give some support for initial few weeks, and then we gradually decrease this oxygen support and they can breathe themselves. That is a kind of a quality of life once the transplantation happens.
So all the chronic lung disease patients who are on oxygen and who have confined themselves to their bed and all, if they are not having any comorbidities and the age is less than 50 years, they are the perfect candidates for lung transplant, and they will be having good outcomes from the lung transplant. They can be free from oxygen, and they can have a good quality of life for almost more than 10 years post transplant.
So to conclude, any patients with persistent breathlessness or discomfort in breathing, any wheezing, chronic coughing, definitely needs evaluation by their clinicians. Possibly they are having some chronic lung disease. This may be in form of ILDs, this may be in form of COPDs. So that needs to be evaluated. For this, Fortis Jaipur has taken an initiative to evaluate the patient with chronic respiratory diseases in form of lung transplant clinic on every 4th Wednesday of the month. Thank you.